Hello everyone and welcome to Rad Chat, founded by me, Jo McNamara.
And me, Namanjot Anderson. Rad Chat is a forward-thinking global knowledge hub where healthcare professionals can advance their expertise in therapeutic radiography and oncology. Unlike traditional academic resources, we blend real-world experience, expert insights, best practice and patient perspectives.
We make advanced knowledge engaging and accessible, supporting continuous learning and professional development without compromising patient care or your personal time, by providing insights into both technical skills and career development, helping you to progress confidently in your field and shape your professional future.
Just to let you know, our episodes may contain sensitive and difficult topics that you might find distressing or triggering. Please consider checking out another episode.
So this is episode 199, which is part of our Living with and Beyond Cancer series, where we're going to be hearing from our next guest, Mandy Gaiman. So she's going to be talking about her breast cancer during pregnancy experience and all about her Instagram channel. So Mandy, welcome to Rad Chat.
Hello, thank you so much for having me. I'm so excited to talk with you guys today.
Oh, thank you so much for coming on. And obviously, time differences have permitted us to finally be in the same digital room at one time. So thank you.
Thank you.
So, Mandy, tell us a little bit about yourself. And if you can, because we do ask this of lots of our guests when they come on to talk about their experiences, and they jump straight into talking about, I've had cancer, and they go straight into that. But you are more than just a cancer diagnosis. So tell us a little bit about yourself.
Well, thanks for saying that. I do appreciate that as a survivor. Yes, obviously I have had cancer and had that during pregnancy, but I'm also a mom. I'm 37 and I'm married to my, we call it in the States, high school sweetheart. So we've been together quite a long time. We've been married about 12 years and have two daughters, one who is 8 and the other is 4. Both are crazy and wild, but wonderful and bring lots of fun and unexpected chaos to our life in the best way. And of course, we're also parents to a geriatric pug dog, and he, I think, surprisingly has more medical issues than I have at this point, which is saying something. But really just kind of, living life, doing the motherhood thing, lots of social events. Like my kids are more social than me, so I feel like I live vicariously through them really most of the day. And obviously enjoying Instagram as kind of a creative outlet. And I'm also a very proud millennial, so I love everything to do with millennial nostalgia and all that brings, thrifting and that sort of thing. So kind of boring, but also, I don't know, fun.
Oh, I don't think that's boring. And I too am married to what you would class as your childhood sweetheart. So yeah, met when I was 16. It's been a long time now. I'm old now, so yeah, it's once you've been through life with someone that long, it's too hard to find someone else, isn't it?
Absolutely. It's going to be too much work. I said that to him when I was diagnosed with cancer. I was like, you're stuck with me. I'm sorry we have to do this, but it's just too much work for you to find someone else at this point. No, but congratulations. I love that. I love that you guys have been together that long.
Thank you. So, Mandy, you've kind of mentioned a few times, the impact that cancer's had on you. Can you tell us, if you don't mind, a little bit about your cancer diagnosis and kind of what you had to go through to get diagnosed?
Absolutely. So I was 32 when I was diagnosed. And as I kind of alluded to, I was 17 weeks pregnant with our second daughter, the now 4-year-old at the time when I was diagnosed. And it was a little bit of a journey to get that diagnosis. Being pregnant, I think a lot of the time the assumption is, oh, well, this is probably due to fluctuating hormones and all of those wonderful yet crazy changes that our bodies go through during pregnancy. So I think because of that, it was a little bit of a delay in getting the official diagnosis, probably from like start to finish of like when I noticed something was a little off to when I actually had, the official piece of paper that said you have breast cancer. It was probably about a month. So, I mean, it wasn't terribly long, but it was also in the middle of COVID-19 and I was pregnant and, just kind of a wild set of circumstances. I also, the type of breast cancer I had was inflammatory breast cancer, which is a little bit of a different beast or an animal when it comes to the breast cancer world, if you will. Typically, it doesn't present as like, you always envision finding it as like a lump or something through a mammogram, but inflammatory doesn't often present that way, and mine did not. So I just happened to pop out of the shower one day and noticed that the skin on my right breast looked strange. Like it looked rashy and a little bit scaly. And so that sort of sent me down the path of what is this? And that eventually, of course, led to the inflammatory breast cancer diagnosis. But obviously being pregnant and then the fact that inflammatory, not as common breast cancer, which I hate saying that, but it only makes up like 1 to 5% of all breast cancer diagnoses. So it was just kind of this weird, perfect storm of events that resulted in this very odd statistic of being pregnant while also having cancer, and not only having cancer, but having this rare form of breast cancer. So once I got diagnosed, it was really from like a 7-day period to when I found myself in the chemotherapy chair getting chemotherapy. And I ended up doing all of my chemotherapy actually while I was pregnant. So it was a total of 13 rounds. So 13 different times going into the cancer center with my bald head and pregnant belly, going through that old chestnut, if you will. And fast forward to 4.5-ish years later, and that's kind of how it all started. Yeah.
Wow. I can't even imagine what it must be like to get a cancer diagnosis while pregnant, because pregnancy in itself, I found really stressful. Just that maternal instinct was rife as soon as I found out I was pregnant. And our baby was born as a result of IVF. So sometimes I wonder, did that play a part in why I felt so protective? But actually, I think talking to other mums, it's one of those common things. You just immediately feel that bond with your baby. How was it kind of getting that diagnosis and also kind of being pregnant and thinking, how is this going to affect my unborn baby?
Yeah, great question. All of that, all the questions were just swirling. And actually, I'm pretty sure, when they called me to say the biopsies come back, this is the result. The first question out of my mouth was, what about this baby? What are we doing? And because, my fear, of course, as a mother was that they were going to say, well, you have to choose, you either can carry this pregnancy, have your baby and risk this developing even further, or you can go through treatment. And so, that was really weighing on me, especially as we were waiting for those biopsy results of what's going to happen with this. And I can't tell you the relief I felt, when in the next breath, the person said, we're treating 2 people now, like this, and that's what we're doing. So, it's very relieving to know that that was even a possibility, because I think most people, including cancer survivors, have no idea that that's even a possibility in treatment. And, we're finding more and more that it is possible to treat a variety of different cancers during pregnancy. And so I think even though there were a lot of questions and unknowns and what's going to happen, will this baby be okay? Is she going to make it? There was also a lot of joy in the fact that obviously getting a cancer diagnosis when you're pregnant is pretty worst case scenario, but having added on to that worst case scenario of like, you're going to have to make this really hard decision, having that part of the worst case scenario taken away was like, okay, well, at least I don't have to do that. And maybe that was a self-preservation thought on my part, but it's like, well, this is bad, but not that bad, So as scary as it was, I think it also provided a lot of motivation that I don't know. I can't say for sure that I would have had that same level of motivation if I wasn't pregnant, to be perfectly honest with you. And I can't attest to that because I haven't experienced it not being pregnant. But, you know, it's kind of just like this weird positive and negative thing at the same time. Yeah.
What were people's views when you walked into the chemo ward as a pregnant woman? Because I would imagine, you know, the stereotype is that you can't have chemotherapy when you're pregnant, and, you know, you sitting there with a baby bump must have worried people. Did you get many kind of weird looks and questions?
You know, I think the blessing in the fact that it was COVID-19 was we were all very secluded at the time. You know, you kind of picture chemo centers, sometimes you're in this like big room with a lot of different people getting treatment, and that wasn't happening as much because of COVID-19. So I sort of felt a little bit more protected when in the actual center. But of course, there's still lots of different nurses and even volunteers that were in the center. And, you know, they come and they stop in and they see how you're doing, which is all very kind. But, you know, immediately everyone, you can't not notice that you're pregnant. So it was kind of like, oh, and you're expecting, you know, there was just kind of this odd dichotomy that you don't expect to see when you walk into anyone having chemotherapy treatment. I actually I've never told anybody this before, except my husband actually, but when I was getting like my outpatient surgery to have my chemo port placed, you know, obviously you go into the surgery center and all that, and they had this kind of old retired guy, doctor. He was an old OBGYN, and he was now kind of working in the surgery center, helping prep and all of that. And he came in and he said, you know, I heard you were here and I heard your story, and I just wanted to come in and say hello. And, you know, I'm an OBGYN. And so it started as this very like comforting thing of like, oh, wow, here's someone who understands. And, you know, I'm sure kind of thought, well, this is wild, but at the same time, like just giving me some reassurance, because obviously you're not seeing a lot of pregnant people even coming in for a surgery of any kind. And so the conversation quickly made a very weird and crazy turn. He's like, well, how are you feeling? Which was very kind. But weirdly, it turned into this conversation. I said, you know, I'm just so honestly just so relieved. Like, I'm in shock, but I'm relieved because I'm able to do this while I'm pregnant. And I don't know what I thought was going to happen. I think I thought his response was going to be something along the lines of, well, I've seen pregnant patients go through this before, or I've actually never had a patient go through, just some kind of conversation. But instead, he used it as this very strange opportunity to start talking about pro-abortion and pro-life and the differences. And I thought, you know, that's not really a conversation that I feel this moment is warranting. You know, maybe talk to me in a year or two and we can sit down for a coffee and have that conversation. But it was, I feel like that moment was very telling of kind of the climate of where we were, at least here in the United States at the time. I felt like we all hear crazy stories about pregnancy, not necessarily about cancer and pregnancy, but, you know, we've all heard, especially as moms, right? The horror stories, if you will. And I thought, how amazing is it that we hear those stories so often and we kind of forget that human element behind the story. Like, we forget there's a real person and a real situation taking place with that person. And in that moment, I think was my first kind of eye-opening experience of like, this is me and this is my pregnancy and my family, but this conversation weirdly is really bigger than just myself, you know? And even like kind of taking that politics side out of it, people have very strong feelings when it comes to pregnancy in general, you know? And so kind of having this added layer and then having a medical professional have that conversation with me, I thought, oh man, like this is going to be an interesting ride, you know, like even having a medical professional start to kind of have those questions and thoughts. It was very eye-opening that this was kind of a phenomena. And I realized I was going to have to navigate some waters that maybe weren't typically navigated, if that makes sense.
Have you ever had to navigate any of those conversations before you've had cancer treatment?
No, no, not at all. And, of course, like you might have those conversations with people depending on what might or might not be going on in, the realm of the news or politics or whatnot. But for me personally, just as a human being in my personal life, I'd never had to have that conversation with someone before. And, it honestly kind of felt a little bit like my story, my situation, which was very real, was suddenly becoming a political talking point. And, I know inevitably politics and medicine, they kind of have to flow together at times. And, I'm not immune to that. And I certainly understand that. But it definitely in that moment made me feel not real, or like, okay, wow, like this person is not very concerned so much about my, state of emotion and mental health right now, or how I'm feeling physically with a child growing inside of me, but more so from like this kind of far away person, and a very strange situation.
So, Mandy, in terms of kind of the delivery, were they quite strict on how you could deliver, when you could deliver?
Yeah, another great question. I personally, selfishly, I was hoping they were going to say, come on in on this day and we're going to knock you out and we're going to take that baby via C-section and you're going to wake up and have a baby, and like that's going to be one less thing you have to even like think about. But alas, that was not the plan. And so, yeah, I actually ended up, they said, you've had a typical vaginal birth before, so we're going to do that again. And it was like, oh man. Not that a C-section by any means is easy. I mean, I've seen what other friends have gone through, but I was like, man, we gotta add just one more like hard thing to this plan. But they ended up like inducing labor a little bit early. So she was born about 3.5 weeks early. So it wasn't, some huge, giant, big lapse of time. But, it was a pretty typical, strangely to say, a very typical delivery. I was part of a research study. I had found somebody here in the United States that was doing a lot of research regarding cancer and pregnancy. And so I really felt strongly when she asked me, would you consider, allowing us to do some extra tests on the placenta and that sort of thing? This could really continue to open up doors as we learn more. And I said, absolutely. So while I kind of like to joke and say, while the birth process itself was very typical, which, birth is a whole other slew of adventure for whoever is doing it. But I felt like it took longer for them. Like they were so like, okay, we're going to take the placenta, preserve it so perfectly. Like, it was like setting up this whole research area, and I'm just laying there spread-legged with this newborn baby in my arms, and they were so like careful, which I so appreciate, that they took that seriously and wanted to use my story and my information for hopefully just wonderful things down the line. But it was very surreal, sitting there with this newborn on your chest and you're like, what is going on down there? This is taking a long time. Besides that, it was a pretty typical birthing experience, I guess you could say.
Mandy, I don't think you realise how rare you are. Not only were you pregnant, delivered vaginally, and also had cancer diagnosis, you also agreed to research. They honestly must have been besides themselves.
You think so? You think that that's okay. Well, maybe that explains a little more of why that was handled so delicate, almost like another birth in itself, but yeah.
What was the research going to be about?
Yeah, so the really cool part is there's it's something done through, it's called the Cancer and Pregnancy Registry here in the United States. And so what they do is they essentially, from the moment your baby is born, they follow you and your child for the first, I believe it's 5 years. And you essentially give them access to additional testing of the placenta, of course, like as we just discussed, but also any medical records having to do with your health or the baby's health surrounding cancer treatment. So, for example, when our daughter was born, they really didn't know, like, do we need to do something with this baby? Like they didn't really know like what they were supposed to be looking for or checking. But so they kind of landed on, well, let's check her heart, because chemo can be very hard on the heart. So I think that was just kind of where they landed with it. So all of those kind of records, with her heart testing, they had access to. And so we're kind of coming up, she's almost 5 really, and soon they won't have access to those records officially anymore. But weirdly, I feel a little bit sad about it. You feel like you're contributing and you feel like, gosh, like what if something from this whole experience and these records that they're digging through, like what if that shows something really amazing that can help somebody else down the line, if that makes sense. So, but that's sort of the process, as they kind of get access to your placenta. That's a weird thing to say, but access to your placenta, and then sort of these specific medical records as you move forward for 5 years.
Mandy, did you or your daughter experience any side effects from chemo?
No, which is a really odd thing I know to say, but the only thing really with my daughter was she was born a little bit small, which we had been kind of warned or told that that's fairly typical for the type of chemotherapy that I was on. But in terms of like anything like developmentally or cognitively or anything like that, she was a very typical baby that was born. And even, now as she's 4.5 going on 5, so far, like there has been nothing odd or off or different than she's met all her milestones, that sort of thing, which of course, like having been diagnosed during pregnancy, you're immediately digging for those stories, right? Like, oh, please, I just need to read a story where everything was fine. And most of them actually were, which is incredible, but you're still going to worry. Of course, you just worry about what if it's me? At the time, they had just started sort of going into this idea of using a drug called Neulasta, which essentially boosts your white blood cells in between chemo treatments. And so they hadn't really had a lot of research at the time regarding what that drug could or could not do if you were a pregnant patient receiving it. But we kind of consulted with a lot of different doctors, and just the nature of the breast cancer, they said, we don't have a lot of research to say it's good, but we don't have research also to say it's bad. And so we kind of feel like it's worth it to give a try to make sure you're getting what you need to be getting to combat this cancer. So of course, that was my biggest concern and worry, was like, what if this drug that they don't really know a lot about is gonna like do something to her? What if she comes out and her head looks like a star? I don't know. What could this do? But she was perfectly fine. So, I just find it amazing. But also, not only did she not really have side effects, I really didn't experience a lot of side effects from chemo while I was going through it as a pregnant woman, which they've actually kind of said a little bit since I went through it, but they're finding that that is more and more common, is that pregnant women don't experience the same sort of side effects typically that a person who's not pregnant would experience going through chemotherapy. And they don't really know why, but they think it has something to do with the level of hormone in the body at the time, and the way that your immune system is working. I always feel kind of embarrassed when people ask that question, because I'm like, it was fine, because I know for a lot of people it is not fine. But as a pregnant woman, weirdly, it was.
Since you finished the treatment, Mandy, have you had any late effects or late consequences of the treatments?
I would say not so much from chemotherapy. After I gave birth to my daughter, it was like 18 days later, and I ended up having a mastectomy. Like I was still wearing that big adult diaper. They probably don't do that in the UK. That's probably just here in the United States that they're making us wear diapers.
No, my wife definitely had them.
Okay. God love her. But, I'm still in like my adult diaper, like going into the surgery to have my breast removed, and they're making me take pregnancy tests. I'm like, oh my God. But I had the mastectomy afterward. That showed a complete response to chemo, which was amazing. I'm not a very cool person, but I feel like that's one cool thing I can say about myself is like, I beat cancer while I was pregnant. That's really the only cool thing about me, but I'm able to boast that now. And kind of after the surgery, that was great news, but because it was inflammatory, I had to have radiation. And so it was a pretty intensive radiation. So I would say effect-wise, the most effects I experience now, kind of post-treatment are really from radiation. My skin will never look the same again. And it's very tight, that sort of thing. It can be uncomfortable at times. But again, I feel like it's pretty minimal compared to what many other people experience. So even though I can complain about tight skin and that sort of thing, I also want to be respectful of those people, knowing that they can have a lot worse at times.
I think that is something that Naman and I hear all the time when we talk with cancer patients. You never want to open-heartedly say, this is really shit. Like, this is really impacting my quality of life, because so many people are like, but I'm thankful I'm alive, or I'm thankful that you've done this treatment, or I know other people have it worse. And we totally understand why, but you also do need to own it. Like, it's absolutely fine to be like, this has affected me, and actually it does stop me from doing certain things. And I think the more people maybe are open about that, the more people kind of will then also open up and share their experiences and go, yeah, I'm thankful I had treatment. I'm thankful I'm alive. I'm thankful my daughter's okay. But do you know what? Actually, yes, there are certain times that I get down about the consequences of treatment that I'm left with. I don't know. So own it, Mandy. It's absolutely fine. And you can moan about anything to do with the consequences of your treatment, because I think it's important. And also for healthcare professionals, we don't hear from patients all the time about what the late side effects are, because they don't want to tell us, because they're like, oh no, it's fine. It's fine. It's fine. Don't worry. Don't worry about me. I know you've saved my life. I'll be thankful and I'll just keep quiet. Whereas meanwhile, you're suffering with, crippling fatigue, and, you think, oh, I'm just tired. I can't moan about that. Please, everyone listening who's gone through cancer, tell us, because it's important for us to know, so that we can then put things in place during treatment to help prepare you for when you ultimately then do experience these side effects.
Thank you for saying that. Like, I really appreciate you saying that, because I do think you're totally right, especially from the medical professional side of things. Because most people aren't going into, especially oncology, anything with the idea of like, oh, I'm going to send them to chemo or radiation or whatever, and then toodaloo. I know that most of those people, you're doing it because you really care about people. And that involves everything from physical to mental to emotional. And I think that's a really good point. Thank you for mentioning that. That kind of gives some good perspective for me, especially, in sharing and moving forward.
Mandy, obviously having a child can impact your body confidence, but then having mastectomy and radiotherapy and kind of the changes to your skin, how are you managing with your body confidence at the moment?
That's a great question. Also, thank you for asking that, because I know I keep saying that, but just thank you for asking. I feel like these are conversations we don't normally have, right? When it comes to, like, I'm just thinking, not that I'm going to corner somebody at the park, another mom, and be like, let me tell you about what I'm going through. But thank you for asking that. I would say the biggest, when it comes to body confidence and that sort of thing, is kind of in between all of this stuff happening with chemo and mastectomy, and I had reconstruction, like all this stuff. I also had an oophorectomy. So I had my ovaries and my tubes removed. And that was kind of a twofold thing. Like, I'm a BRCA2 mutation winner. And so that was kind of to help prevent future cancers. And also my breast cancer was hormone fueled. So it was also to try and reduce that risk as well. It was just a decision I thought was the best to make. I wasn't going to go through more pregnancy. I had decided that pretty quickly into my diagnosis. And so at 33, I went into menopause because I had this removed. And so while it's not exactly, it's not like I had cancer treatment that caused some of these body changes and issues, but the decision was definitely driven by that cancer experience that have caused a lot of these different body changes and maybe self-confidence things. I would say to better answer your question, it's kind of just an ever-evolving process. My body feels much different than it did before I had children, just like we were saying, but it also feels much different than before I had chemotherapy, even as a pregnant woman. And so I definitely feel like it's kind of, there's two sides to the coin. On one side of the coin, I feel much older than my actual age. Like I tend to, at a social gathering, I'm relating a lot more to like the 70 and 80-year-olds. Like, I'm like, you tell me your ailments and I'll tell you my ailments and we'll compare notes. Like, because that's my life. Like, that's what I'm thinking about all the time. And so, not that I'm like making every decision every day around that, but that's my everyday reality, taking post-cancer meds and that sort of thing. So I tend to relate a bit more to those people when it comes to those types of conversations than I'm relating to some of my peers who are still, very much growing their families and do we want another child or not, And so I think because of that a bit, it's tended to make me feel a little bit differently about my body, which I know I'm sure every cancer survivor you guys probably talk to say similarly of like, I'm trying to get to know my new body and my new normal. Yes, all of that for sure. But also trying to learn how to embrace and love my body as a not even 40-year-old woman, if that makes sense. And so lots of therapy, to really just get to the crux of it, lots of therapy, and just trying to find other survivors as well who are close in age or have been through a similar cancer experience to me. There's a lot of good things that come from those conversations and just feeling like you're heard and somebody understands and you're not just withering away into a bag of bones before your still very young husband's eyes,
Mandy, I'm glad you touched on therapy there because it's something that, as someone from the UK, we do associate Americans with having more access to. In the UK, it can be really difficult unless you pray privately to get a therapist. It can be really difficult to get that psychological support. How much of an impact does therapy have? I know you kind of said it quite flippantly, going, "Oh, I've had lots of therapy," but how important has it been for you to have that extent of therapy to really get over that cancer diagnosis and what you've been through?
Huge. I mean, it's been huge. And I will say, we're very lucky. I'm located in Cincinnati, Ohio, within the United States. And like, weirdly, I don't know if this is really a good thing to boast, but we are a very cancer-centric city, meaning we have a lot of different hospital systems. We have a lot of resources here, a lot of nonprofits, which is wonderful. That's a beautiful gift. I wish that other people in our United States and our friends across the pond, I wish you guys had that same level of resource and support surrounding you, very within your own kind of communities. But I will say we have an organization here. It's nonprofit, it's free, and they specifically cater to cancer survivors and their families. And so it's a free service that you can essentially reach out and sign up for, and you get put with a therapist who is very well versed, and that's kind of their specialty, is cancer survivorship. And so I've now been, I think, seeing somebody there for about 4 years, and I think it's a very unique situation because she's so well versed, obviously, in like the cancer world. I can talk with her very openly about cancer related topics, right? I kind of feel the same about you guys as I'm talking with you. If I was having a conversation just with my neighbor across the street, it would look much differently because I know she's not as familiar with a cancer diagnosis, and thank God. But there's a type of freedom there to be able to talk with somebody, not only a therapist who is well versed in, PTSD or anxiety, or a medical anxiety, but also somebody who knows cancer specifically. And I think that's been a huge tool, is to be able to talk to somebody who really gets it. And I don't know if you guys have heard this. This is a very new thing for me. But my therapist says that trauma tends to beget trauma. So like, obviously anybody going through a cancer diagnosis, whether you're pregnant or not, that's very traumatic for anybody, no matter what age. It's a traumatic thing. And so what I found is, even though maybe I'm not, in chemotherapy anymore, I'm not doing radiation anymore, there's like weirdly like other trauma that kind of will start to pop up, or things that I've experienced in life, way pre-cancer diagnosis even, that I'll start to like kind of think about or have moments of. It's the weirdest thing. And I was kind of saying this to my therapist recently, and she's like, oh, well, yeah, trauma begets trauma. We see this all the time, like cancer survivors are like, I made it, or even like, I'm making it. And then the next thing they're like, I got to talk about my childhood. You know what I mean? Like, it's this very interesting dynamic that happens. And I don't know if that has to do with the fact that, maybe partly the fact that you're faced with your own mortality with a cancer diagnosis. And so the next thing it's like, I really need to get my affairs in order about that stuff that happened. You know what I mean? Like, that really has been weighing on my mind. And so I say all this is like, yes, therapy has been so helpful in moving forward through the diagnosis and the aftermath and like what that looks like. Definitely. But it also has been very helpful to kind of find some peace and joy from even like past things, weirdly, which you wouldn't expect from a cancer therapist. But I don't know, it's been only positive in summary.
Therapist sounds amazing. Sounds like the right bit of healing that you needed. I think to go one step further from what they said about the trauma, there's something called the Karpman triangle, which is about rescuer, persecutor, or victim, I think. And we see this in clinics and with patients, that they may come for their treatment for radiotherapy and they're feeling like the victim, like, why me? Why have I got cancer? Or then they may, on some days, maybe if the machine's broken down, like, why are you making my day even worse? That kind of thing as a persecutor. And then eventually they become the rescuer to help other people by sharing their stories or guide them through treatment. But that's how another way of kind of managing the trauma is realizing where you are in the triangle. It's something I teach all the time. Very psychology focused, but I find it really interesting because once you think of it that way, you'll notice everyone, including yourself, goes through that triangle every single day.
Oh, that's fascinating. I have never, in my 4 years of therapy, I have never heard of that. So I definitely, I want to look more into that. That's so interesting. Thank you for sharing that.
Mandy's going to go to a therapist and go, I want to talk to you about, and she'll be like, whoa, where have you learned this from? Just two radiographers in the UK.
You talked to Rad Chat, didn't you? Okay, well.
So Mandy, on that same theme of sharing your experience, tell us about social media. Why have you taken to social media to share your story?
Yeah. Well, honestly, at first it kind of started as very much a necessity because of COVID at the time. Like, we weren't really able to see our friends and family in person very often, especially going through cancer treatment, just compromised immune system, all of that. And so I sort of started just kind of posting about what was going on social media, because it was just kind of like a quick, almost lazy way for me to kind of put out and update everybody in one fell swoop, you know what I mean? And then it kind of evolved into something else, which was me seeking other women who had been through cancer and pregnancy. And I kind of started using it for those connections, and finding those people and saying like, hey, I saw you went through this. What was your experience? How are you doing now? And so I found some really amazing women that way, and support systems that way, kind of people that not only walked the walk, but had to talk the talk. And so it kind of evolved to that. And then I realized that in kind of those two schools of thought, merging those things into whatever it's become now. It's just very much this very cool way to continue sharing my story, but also to really focus on like life post cancer. And I think a lot of people, no matter, again, whether you're diagnosed as a pregnant person or not, a lot of people are looking for that, what's going to happen after this? You know, they want to see what happens after, because of course your head is full of the worst case scenario. And so I think there's just a really powerful thing in being able to show people what's going on kind of after the fact. And I think it makes people feel seen and heard, most certainly, but I think it also just, it can be a very motivating factor in feeling like, okay, this isn't forever. Like this crazy lady who was pregnant got through hers, and look, she's doing okay. She's a little nuts, but she's doing okay. And, you know, just kind of seeing that there is life after, I think is really powerful. You know, there's a lot of just like normal everyday stuff that I'm sharing, but also trying to share like how there always is kind of this umbrella of I'm always going to be a cancer patient. And I think, you know, even my family, like parents, friends, that sort of thing, they really struggle with that. You know, it's like, well, but you're good now. Like, you're so good and you're moving on. And it's like, but I'm not. I mean, like, I'm physically much better, and that's wonderful. That's a gift. But also, like, pretty much every decision, medically at least, that I'm going to be making from here on out is always going to be under that umbrella. And even sometimes on a social level or an emotional level, you know, is always kind of made with that in the background or over my head. And I don't necessarily think that that's wrong, and I don't think that that's a bad thing. I think because that's just an uncomfortable thing to say, or an uncomfortable thing even to see your loved one say, you know, there's also a lot of good in that, you know, like I feel like I'm much more protective of my time as an individual now. You know, again, going back to that, if you're faced with your own mortality, like, do I really want to have to volunteer at this thing I didn't really want to do? No, I actually really want to volunteer over here. You know, it really kind of puts things into perspective. And I don't think that's always a bad thing. I think it really can be a good thing. And I hope that my page is sharing that for other people. I hope that they see that, and I hope they feel motivated by that as well.
I always picture myself after giving birth to Noah in a park with a group of mums that I met through what we call here in the UK NCT classes. So it's kind of preparing you for birth and then motherhood. Really, it's just a great opportunity to get to know other people who are going through the same hell as you with a newborn baby. But I always think that, you know, we were there in that park and we just spent an hour moaning about the fact that we're new mums, and yes, we're very joyous about the fact we have these amazing babies, but God, are we tired, and God, do our bits hurt, and our breasts are hurting, and every time he screams I'm like, milk is coming out. Yeah, you just moan. And the thing that I am in awe of is the fact that you would have been going through that same process whilst also dealing with cancer patients. Like, you would be the same if you're in a peer support group. You hear people going, oh my gosh, menopause, it's horrific, like horrific. How are you coping with menopause? But those two worlds colliding at the same time, I just can't imagine. And I would imagine that's why having peer support, whether that's on social media or face-to-face or through a charity, is so powerful when you have rare conditions.
Absolutely. Absolutely. And, you know, I think even to your point, you know, there's all kinds of different situations even that women have to experience during and after pregnancy that might not be deemed typical for pregnancy, you know, just like moms of twins or triplets or other multiples. You know, they're obviously like, they can relate to somebody who's had a child like myself, but they're really looking for people that have also had multiples, that they can be like, okay, I'm not crazy, right? Like, this is really hard, you know? I think that's such a great point, you know, that we all need to be seeking out those individuals. And what a gift that we have in social, you know, we always hear the bad stuff, but what a gift that we have this ability to be able to find those people in a way that we probably never would have been able to find them before.
Mandy, how do people find you on social media? What's your handle?
It is Warrior Mama Mandy, all one word. So just ridiculously to the point, and a little boastful, I admit, but it's stuck. And so that's what we're going with. And yeah, I've met some of the most incredible people that way. And not just me reaching out, but other people finding me and reaching out. And yeah, I'd love to connect with anybody. Even if they're not cancer pregnant people, you know, just anybody who needs to feel like they need to be seen and heard post cancer or post trauma. You're my people. So come on down to the house, you know.
The most American phrase to end on there, Mandy. So we always end our episodes with top tips. Are there any top tips you would like to give any of our listeners, whether that's patients who are going through a cancer diagnosis and treatment, anyone who's pregnant, any students or healthcare professionals? This is your opportunity. Spread whatever you would like to spread digitally.
I would say the biggest thing, and like this is for everybody, but probably more aimed toward medical professionals or like students who are aiming to become a medical professional. I would say one of the greatest gifts that you can give, especially somebody going through cancer while they're pregnant, is the gift of their pregnancy being included in your conversations. Obviously, needing to be included for medical decision making, yes. But I think it's very easy to forget that that person sitting in front of you with a cancer diagnosis is also pregnant, and they're also going through all the pregnancy things. And it really does make a difference to have somebody who doesn't really need to, at the end of the day, having somebody say like, how's your pregnancy? Is it a girl or a boy? Are you finding out? Have you done anything with the nursery? Because even though you're going through this very like medically specific situation and having lots of appointments, you also are feeling the joy of the fact that you're pregnant and you're adding to your family. And that's very much a weird place to exist. But having a medical professional humanize you a bit in that situation and circumstance, it makes such a difference, because you just feel like, okay, I trust you so much with my care and with my unborn baby's care. But when you're asking those questions, it really does make you, at least as a patient, a mother, feel like you're not just worried about getting me through this treatment. You're also worried about me and this unborn baby who, though we cannot see it, you're acknowledging that there's two of us here. And I think that goes a really long way. And also on the kind of flip side of that for patients is you deserve that kind of treatment from your team and trust from your team. And so I would just encourage anybody who might find themselves in a similar circumstance to, it's okay to find somebody that might not be the first person you thought was going to be your right fit. And, you know, I think making sure that everybody feels seen, heard, cared for, and on the same page will make a world of difference. And so, yeah, I would just want to empower those people to also find those wonderful medical professionals that are out there. And there's so many of them who are willing to look at you like a person and your baby as a person, and not just, you know, patient number 65 of the day or whatever. Yeah, that would be my top tip.
Brilliant. Thank you so much, Mandy, for joining us on Rad Chat. It's been a pleasure. So thank you all for listening to Rad Chat. We've had Mandy Guyman talking about her experience of breast cancer during pregnancy. Thank you very much.
Thank you.
Our next guest to feature will be us, Naman and Joe, for our 200th CPD episode. Thank you for listening and take care. Well, you can use this episode as part of our free continual professional development, accredited content, which offers flexible learning that fits your busy schedule. Just check out the show notes for the reflective questions, links to literature and resources, and link to the completed form to receive your accredited certificate.
Stay up to date with the latest radiotherapy and oncology advancements by liking and following us on social media and hitting subscribe wherever you get your podcasts.
Please do join our supportive community designed by professionals who understand the unique challenges of working within radiotherapy and oncology. Follow us across all of our social media channels and make sure to check out our website www.radchat.co.uk. Together, we're actively working to improve our profession and make a lasting positive impact on cancer care.
It goes without saying that we can't achieve this alone. It takes all of us working together to create real change. That's why we value every voice and every contribution. We ask that you listen and learn and spread the word, share your story with us and connect with us.
And if you have liked this content, why not buy us a coffee? Go to our website and drop us some love. Thank you all for listening and take care.